It is 1:02 p.m. And Britton, would you mind doing the roll call, please?
Sure. Dr. Baravecchio. Did we move you over? Can you hear us, Dr. Baravecchio? Okay, we'll go back. Mr. Billings,
Here.
Ms. Crane,
Here.
Ms. Hagan,
Here.
Ms. Hano,
Here.
Ms. Harmon,
Here.
Ms. Engel, Ms. Nguyen,
Present.
perfect. Mr. Piontek. Ms. Richard is not here. I don't know if Ms. East is here. I think she was that might be tomorrow. I'm not sure she's here today. Oh, I see Patty. Dr. Baravecchio, can you hear us? Dr. Baravecchio, can you hear us? Let's see, Mr. Rocca.
Here.
Ms. Stewart. And Ms. Womack.
Here.
And you have 9, so you do have a quorum.
All right, thank you, Brenton. Before we get started, I'd just like to remind you all of a few rules. For committee members and members of the public attending in person, please raise your hand to speak and wait to be recognized by the chair before speaking. To help the meeting run smoothly, please keep side conversations to a minimum and comments related to the topic we are discussing. For those committee members who are attending virtually, please remember you must be on camera and have your first and last name showing to be counted towards our quorum. Please keep microphones muted unless called upon by the chair. Electronically raise your hand and request to speak and wait to be called on by the chair. For attendees, electronically raise your hand to request to speak. Once recognized by the chair, your microphone will be turned on. After speaking, the microphone will be returned to mute. Also, the Q&A is to only be used by those needing an ADA accommodation to participate in the meeting. Public comment will not be accepted until the Q&A, except for those individuals who requested the accommodation. As for order, committee members in person and virtually will be allowed to speak first. Public members in person will then be called on, followed by public participating virtually who have their hands raised. Comments in the Q&A will be addressed last. As with all hybrid meetings, it can be difficult to keep track of all those wanting to speak in person and virtually. Please be patient. All comments and questions from committee members and the public may be limited to 3 minutes or less should we run into time constraints. So please keep that in mind. Also, comments about a person's character will not be allowed. Finally, members of the public will have the opportunity to provide public comment before each vote and during designated public comment periods. The chair may also use their discretion to determine if comments will be accepted outside of those times. Everyone should have reviewed the April meeting summary, which was attached in the agenda you received via email. There's also a copy in your committee packet. Can I get a motion to adopt the April meeting summary?
So moved.
Tori Roca has motions to recommend. So I'm sorry. He motions to recommend the approval of the meeting summary. Is there a second? Second. Is there any discussion?
Mr. Billings.
Thank you. So Jill and Angela Harmon, second. Is there any discussion?
Well,
Is there any public comment?
you.
Okay, based on the updated public meeting law, we will now do a roll call vote. Brenton, please call the roll.
Yay or yes to pass the April meeting summary, a no would be to not pass that motion. Dr. Baravecchio. Okay. Ms. Crane,
Yes.
Ms. Hagan,
Yes.
Ms. Hayno, Jill, Hayno. Oh, yes, okay. Gotta say it. Ms. Harmon,
Yes.
Ms. Hunt, Ms. Nguyen,
Yes.
Mr. Piontek, Ms. Richard, Mr. Rocca. Yes. Ms. Womack.
Yes.
Dr. Baravecchio,
I'm here, but I have a conflict and Lenora Robinson will be joining on my behalf.
gotcha. Do you, while we have you here, do you vote to approve or not approve the April meeting summary?
Approve.
I'm sorry, Brendan. Yes, from me, I was
Got it.
doing.
So we have 8 yeas, motion passes.
Thank you, Brenton. The motion to accept the October meeting summary is passed by a vote of 8-0. Next, we're going to do the non-contractual updates with Julie F. Hagan. First on the agenda is an update on non-contractual activities. We have Julie from OCDD who will share with us updates from the department. Julie, would you like to get us started, please?
Sure. So right now, at the federal level, there are lots and lots and lots of regulatory changes that are being made that will have an impact to our IDD community. I'm going to talk with you guys in depth about one of them being the access rule, but I do want to make sure everybody's aware that there are others as well. There is an update to section 504 ADA or the ADA compliance. Very substantial and significant changes that will impact people's ability to have access at physicians' offices and hospitals. There's a lot around discrimination for people with disabilities in terms of having access to medical care, being driven by some of the things that happened during COVID and prioritizing who got certain medical treatments. There's a lot around, website development. Some of you may be familiar with the Olmstead, which requires that people with disabilities be able to live in the least restrictive environment. Before, we all had to follow Olmstead because it was a federal law. Well, it now codifies it in section 504. So it's more than just kind of a finding, but things that hold more authority in terms of what we have to do. So I'm still trying to learn a lot more about that, but I do think that's something as well that might be helpful for the council to have more information on. And I'm happy to provide that. Again, we're still working to gather some information around that. There was also federal regulation changes around adult protective services. So there's now formal guidance for any and all abuse and neglect investigations for things that our adult protective services agencies have to follow. That does apply to child protective services, adult protective services, and some states don't have elderly protective services like we do. Some do that in APS, but these new regulations that are coming from the Administration on Community Living will apply to all. And it really just puts into place specific requirements that were not in place before. And then there were also some federal regulatory changes around institutional settings. So there's some reporting that our ICFs are going to have to do that they did not have to do before. There is some discussion around minimum staffing requirements that we'll be looking at. So there's a lot of interconnectivity, especially with Section 504 APS and the access rule. The Centers for Medicaid, Medicare Services, Administration for Community Living came out with these regulations kind of around the same time. And we've been to a few conferences now and had some meetings with them where we know they, a lot of times CMS will put something out and they don't talk to like administrational community living or the people who are doing sort of like, your APS rules or your section 504. They talked about, they worked on both of these hand in hand so that one kind of complemented the other. And I'll show you some examples of that as we look through the access rule, but, they are encouraging states to really make sure that we have communication as we look towards coming into compliance. I'll jump into the access rule. I'm not going to read every single slide. I'll give you guys, I tried to give more information and I'm happy to take questions on this, but what I guess I do want to share, what CMS has said is they put this regulation out about the access rule. You will see in here that we have, some things have 1 year for us to come into compliance. Some things are as far away as 6 years before we have to come into compliance because they're going to take a little bit longer for us to work on. But what CMS did was they put the rule out and they said they would work with stakeholders and states to then define some additional sub-regulatory guidance. So there's the rule, and I want to make sure everybody sort of has a high level understanding of the rule, but I do want to because I've already started to get a lot of calls about this from people like, well, what exactly does this mean? Or what does that mean? There's still a lot that we don't know, and we will have to wait for that additional guidance before we know exactly what we have to do to be in compliance with some of these rules. But as we go through it, you'll see, so the access rule itself covers, and we're going to go through each of these areas, but it covers all that. It's a huge rule. It's probably about 600 pages if you read it. I've tried to read the whole thing. I kept falling asleep and, you're trying to drink wine when you do it. But it's a lot, and there's a lot of things that sort of try to summarize it and help us understand what that means. This is, just like when the settings rule came out in 2014, we spent 10 years talking about the settings rule. We're still talking about the settings rule. This new access rule will be one that we're talking about. Some of it does say we have to come into compliance in 6 years. States have all said there's no way we're really going to do this in 6 years. So I anticipate that we'll have to ask for some extensions along the way with some of these things. Because as you'll see, there's a lot of reporting we have to do. Anything that says reporting, it's not like we just kind of have this neat little report that we can suddenly put on the website. That'd be easy. It's how are we actually going to gather the information to be able to report on it? You have to have an IT system, which then takes time to build it and to think about it. So again, we'll kind of go through what I've done. I will share with the council. I put this presentation together for the council, and because I've gotten so many questions, we are in the process of planning a webinar or some way that we can really start to more broadly communicate this information. There is a home and community-based services conference in August, and I know a lot of our team members have members that are going. So I was really going to wait that conference. There are intensive, I think it's a 4-day conference, and there's intensives from CMS where they're getting into more details of this throughout the conference. So once we have an opportunity to attend that and tweak or modify anything we learn from that, we're going to really be talking about trying to hold webinars and information sharing. I am looking at doing another roadshow like I've done before around October, November timeframe, and we'll talk a lot about this here as well. So you can go on and go to the next slide. One of the things that CMS talks a lot about as it relates to all of these is the person-centered planning. And so we really do now, everyone in Louisiana does have a person-centered plan that is updated every year. So we are, and as part of that, there is a functional need assessment. One of the things that we're trying to make sure is we believe the assessment we do would meet compliance, but we need to make sure. We don't know, is CMS going to come out with more specific requirements about what that assessment needs to look like? And then we'll have to tell, the number of people who do get their plans updated every year. Again, we already report this in terms of compliance. And so we do feel like this is one from a compliance perspective, that we are in okay shape with. Now, the quality of the plans is something they'll start looking at, and we do believe that we have room for improvement or opportunity for improvement when it comes to the quality of what is in our person-centered plan. All right, next slide is the incident management. So, oh boy, this one's gonna take a lot of work. So right now in Louisiana, we call a lot of things critical incidents. When a person, for example, has a pneumonia or has, 3 falls in a certain period of time, we call that a critical incident. In the new access rule, when CMS is mentioning critical incidents, they are talking about things that fall really more in the realm of abuse, neglect, exploitation. You can see those, they're saying your critical incidents must include verbal, physical, sexual abuse, neglect, exploitation, misuse or authorized use of restrictive interventions or seclusion, medication errors that cause negative impact, and then unexplained or anticipated deaths. So when there is one of those events that happen, there are now reporting requirements that we will have to define. They are going to allow states to define what is the length of time of the investigation that must be done, what is the process you follow, which we have now. We already have that in place. What we will need to look at and what we're still not sure of, are they going to give us definitions of these things? Are we going to get to have the definitions? Because when you look across the board, different people define these different ways. So we're going to need to have some work on that. The other thing that's interesting, and this is where I mentioned that we have the APS rule that came out. This is where those two kind of intersect. It requires that as states, not only do we make sure that we're investigating things that were reported, but that we're using opportunities to pull other data from the other data systems to make sure that we're able to have a way to catch unreported things. So maybe somebody went to the hospital with a broken bone. Well, we need to be able to pull that there was a broken bone from our Medicaid data when they went to the ER, and then make sure, was a critical incident filed on there? Was there potential abuse and neglect that needed to be investigated? We're also going to have to be able to bump into the APS, which for us, and Natalie may want to share more. Natalie didn't get a chance to introduce herself. For those of you who don't know her, that's Natalie. I always say your last name wrong. East from OAAS. She's the Deputy Assistant Secretary there. So APS falls under OAS, but we'll have to figure out how to connect with EPS and Child Protective Services, which are in different sections, but there is now a requirement that we figure out how we access where appropriate and how appropriate mechanisms that we can look in those systems to make sure there weren't things that went unreported in our system so that we can investigate it. That's going to take some work to figure out, we'll have to have agreements. We'll have to figure out how that happens. Okay. And then again, not only do we have to have the investigation done, but we will have to have mechanisms that we're looking at kind of the aggregate data, and that we have the ability to track and trend that so that we can look for problematic areas, across the state and in different ways. So you can see we have 3 years to do that. We do have, you can go to the next slide, but kind of the last piece of that is that states have to have an electronic system within 5 years. So they gave a little more time. So we have the benefit in Louisiana that we already have a system that APS uses, our program offices and OAS and OCDD uses, Medicaid uses, Health Standard uses to report critical incidents. So at least we have something in place now. However, it doesn't do any of the reporting or aggregate data. So we still have major work to do. Some states don't even have a system at all that's electronic to collect that information. So they gave more time because some of the feedback they got is going to take time to build a system like that will do all of these things. So again, all these things, as you can start to see, are going to cost us some money. Keep going. You can keep going. It also requires that we have a grievance system, and so this is something that we will have to build in Louisiana, so that when there is a grievance, whether it is related to student performance or provider performance, that there is a mechanism, you know, that for folks not following their plans of care, that there is a mechanism for people to be able to file that grievance, that we have a process that ensures that that's looked into and responded to within the 90 calendar days. So unlike the critical incidents, they did say states can set it, they did set a time frame in the requirements for this of 90 days. And that we make sure that we have information in plain language so that people understand where to go and how to file that grievance and what information has to come. And we have 2 years to do that. And this one, we're not worried about having to have a grievance, you know, about the fact that there's a grievance. We're worried about how do you actually get an electronic system in place that can track and allow all that to happen. Probably the one I've gotten the most questions about then is around the payment adequacy. So this one I think will probably be of great interest to the council and others, because I know we've had conversations around this. So we are now going to have to report on the percentage of the rate that is paid to the direct support worker by service and by providers. We do have to separate out payments to workers for self-direction because they understand that that looks a little bit differently. And then separate out facility-related costs. So this is for any service that's provided by a direct support type worker, including habilitation and employment type services. So within 3 years, we have to say this is how we're going to do it. And then within 4 years, we have to be able to have a mechanism to be able to report that out. And then there is an additional requirement that within 6 years, and so they give more time to be able to do this, that within 6 years, we assure that that 80% of the rate that the provider receives is going to the direct care worker. That sounds easy to figure out, but it's not, because there are, like, what do you count in that 80%? How do you include overtime? How do you include benefits? How do you include paid time off? How is all of that bundled and calculated in that 80%?
There's still the, you know, we're looking at value-based payments, so how do you count those? And there's still the you know, some people have said, why is it so long? Well, it's so long because there are a lot of things. This is gonna require a lot more guidance from CMS to us in terms of what their expectations are for us to be able to count that. So we are, you know, I've already started getting questions on my end. Our IFS service in the now and the CLS service in the row and the family support and children's choice, we have a habilitated component to it. So the 80% payment does not apply to habilitation services, which we normally think of as the services people get when they go to a day program or receiving employment services. But the question is, well, because there's a habilitated component in your rate, does that mean that it does or doesn't count for those other services? And I've asked them that question directly, and they told me, I don't know, you gotta wait for the sub-regulatory guidance. So they said it would probably be a state by state decision. There is also the ability to have a hardship exemption and a separate small provider exemption that those providers wouldn't necessarily then be held to that 80%. They clarified for us, I'll let you know, that that's only temporary. So that doesn't mean that if you meet a hardship or a small provider exemption, that you don't ever have to meet this 80%. It just means that there may be some reason that those providers need a little more time, and you have the ability to give them an exception, sort of like we did with our settings rule, where we did for employment providers. If you're not in compliance, you have to do it within the next year. So those exemptions are only a brief period of time. So you know that it's not forever. And then this is something else you guys may be interested in. We have to develop something called an interested parties advisory group, which are people receiving services, family members of people receiving services, direct care workers directly. that as we look at our rates and develop our rates, we have to have this interested parties advisory group that advises us on what those rates need to look like. We have to do some rate analysis every 2 years, so we have to enact this group at a minimum of every 2 years. That's a good Great. Waiting list and access reporting, we will have to report on the average amount of time from the approval of services to when services begin. So we are still waiting on some guidance. We'll have to have some guidance. So for us, does that mean from the time that you're linked to your support coordinator to the time you actually start with services? Does that mean from the time you're going to care? Like, we need some guidance, some additional guidance in terms of exactly which specific timeframes they're looking for. And then they're also looking, and I'll be honest with you, this one worries me a little bit. They're looking at the percentage of authorized hours provided. What they've said is that they're worried that there are a lot of people who are not getting all their hours because of our workforce crisis. And I get that. But we know, even before our workforce crisis, we only use of all the hours that people have approved, we only used around 75% of them. That's because a person may decide, hey, I don't need you today, or hey, you can go home, I don't need you today. And so they're not getting those hours. So I have gone on record too with CMS to say, like, is there some way that we can consider that? Because I don't want to lose the flexibility of what we have within our system. And I don't, like, to me, there's a difference in if you're not getting the hours because you don't have to work through versus you're not getting the hours because you didn't need them for something at that point. So I'm hoping that we have some way of reporting that separately. And then for us on the BD side, we will have to talk about our screening that we have for individuals that are on the list for eligibility and the rescreening and the frequencies, the number of people on the list, and then again, the average amount of time people are waiting. So we will have to report that across OAAS and OCD. We do a lot of that now, but again, some of these, the definitions and the data points will need to be done. And we have 3 years to do that. CMS has told us that they're working on like a dashboard and ways for us to report it, so states can more easily report that up to them. This is the one we probably know the least about right now, is the quality measure set. So we have a certain set of indicators that we have to report to CMS on our waivers every so often, and they're updating. There are some indicators that are like standardized assessments that we have to use, which we already do the NCI IUD survey. So that's one of the approved ones. So we do have some measures, but they're going to come up with lots of other measures, some that we'll get to define, some that they'll tell us what we need to have. They are, there is a call out right now. If any of you would be interested in participating on a CMS work group, they have a call out, and if anybody's interested, you can email me and I'll shoot you the address to send to apply for it. I'll put that in here. But you can write to them and tell them that you would like to be a part of the group that is determining what the quality factors are that states will have to follow and that states will have to report on to show that we're actually helping people. That's the goal. Next is website transparency. You know, we do put a lot on our website right now. We are always looking at ways to make that a little bit more user friendly than what we do. We do hear lots of concerns about that. So that one it's not, they don't have a lot of guidance on that, except we have to be able to have access. Now, in that section 504 I mentioned earlier, there's a lot of information about what is required with section 504 compliance in terms of what you have to have on your website, how you get to it. You know, the number of clicks and colors, and there's lots of different requirements to make sure folks are able to access that.
I'm gonna have to ask you to call real quick, because I think they say the same goes out. These things might go up, so. Pause for a moment.
Yeah, sit in camera now. I'm trying to chat to somebody else.
Do I need to start at some different point?
So.
You want me to keep going?
Yeah, keep going.
If you have questions, I think they're bad. I'm also.
And Lindsay, who's our transcriptionist, you can just shoot me a text and make sure you get here in time. That'd be great.
Jill, can you hear us? Thumbs up? Okay. Great. So that's a lot of stuff about what's like. The Medicaid Advisory Committee and Beneficiary Advisory Committee. So right now there is already a
Now you're really low, Julie.
and you know I'm loud, so I don't know if we turn it up.
It sounded like you were on a microphone and then it like went away.
We're trying to figure it out. Jill, is this any better? Yeah. Okay, Jill, you can hear me stop. So there's currently a MCO, it's right there, Medical Care Advisory Committee. That will have to be repurposed to be called the Medicaid Advisory Committee. We do have a MCAC now. Some of the membership will need to change on that committee to be a MAC. There's a lot of focus on kind of what happens in hospitals and probably here around that. So they'll need to begin to embed some discussion around kind of community-based services, which are not typically part of the active. They're brand new. A lot of people are interested in about this. It's a beneficiary advisory committee that is made up specifically of people who live experiences, people who receive services, family members who support them. Will be part of this beneficiary advisory council, and then we'll choose members from the MAC to be a part of the MAC. So there will be a larger MAC that will go into MAC, but it will be really to inform Medicaid policy is what it will be on, and it will not just be HCS. So a lot of times, I know we talk about access really in a lot of other areas that are, outside of HCS. It will be limited to Medicaid, so it will cover, educational, things outside of our department. But it will be to really inform what happens at the Medicaid level. So that has to happen within a year. So that will be pretty quick. That people will be starting to see once we, kind of wrap our minds around making sure we have our agendas and how we're going to operate and whatnot. But I know I've already offered, because folks told me, we don't know how we're going to get people interested. I'm like, we're looking at this. And lots of people who are probably interested in serving on the beneficiary advisory council. So, more to come on that one really quickly. All right. So the next two slides are really just, so when you look at this, there's and I didn't focus on, this is 1 year, 2 year, 3 year, 4 year on a lot of them.
but the next two slides are just two different ways of looking at it. In terms of, the things that we're required to do and in what time frame. In terms of, to be able to get us to implementation. And then because I stole most of these slides on some other presentations, I'm not sure to put the resources because in full transparency, I was plagiarized from some CMS presentations and some other things. But again, I'm happy to answer questions. I actually like this one better. To me, it's we're one of those things that we have 2 or 3 different time frames for us to do things. So I like that presentation better. Before COVID, I used to come to the council all the time and say, hey, we want feedback on what you would like for our major activities. Yeah, I didn't do that during COVID because that was our major activity for 2 years. And then once we got money for access, we were like, did get feedback on, American Rescue Plan Act, I got, feedback from folks around that. But to be honest with you, we have now until December of 2025 to spend our Rescue Plan Act dollars. And we have several initiatives that are in my meeting council report that I report on all the time. And now we have access rules. So we need our focus in the next years at least, where it will be difficult for us to be able to have the bandwidth or resources do much more than finalizing compliance with the setting rule, working to finalize all of our Rescue Plan Act dollars, and then working on that access rule. I think these are all important things that will move us where, in a positive direction. But again, sometimes folks kind of say, well, what about this or what about this? And so while we're working through these, there might be different components that we work on as they relate to this, but we probably will be needing to focus a lot of attention. So, Angie, I did last night, but are there any questions about that? When I told because we were going to do a battlegrounds, and we get out, but we do not have to be there. We're not so the is not on the side. So I was very impressed. I wish I would have been super great. So yeah, and then that's one of the things we can do. It's very good when it comes to it. So anything that variance that are but I can take it
Can I just say what I hear instead of texting you, Brendan?
We can hear you, Bill.
Cause when you first started talking, Jules, it sounded like you were on a microphone that like blew out. And that there are no, that we don't use the, so I don't know, but now all I hear is mumbling.
I think it's tied to yeah, we're gonna have to take a break from there. I don't know what we want to get here. Yeah, I'm not sure. Let's take the call.
Jill, can you hear us now? How does it sound? Jill or someone else? Testing 1, 2. I see Pascal thumbs.
It
Yeah.
sounds more clear.
It's more clear.
Yes.
And I had a few questions too.
Okay, I think we need to get everybody back in.
Yeah,
We're still on pause.
break right now, so hold those questions.
Yeah, as soon as we come back, you can ask your questions, Tony, after.
And
Eric.
I can't even ask any question because when I tried, I couldn't even type in anything with a Q&A.
So we know that your hand is raised now, Eric, so we'll make sure that we let the chair know,
It's better.
so he can
Lindsay said
call on
she can
you.
hear now. Okay. Let's get everybody back in then, and we will resume in a second.
So we have a quorum.
Let me go ahead and do a roll call real quick, just to make sure, but I think we do.
All right.
Right.
Dr. Vecchio, I think she had jumped off. What's that?
Great meeting, Mr. Billings.
All right, so just doing a quick roll call, guys. Mr. Billings,
Here.
Ms. Crane, she stepped out.
She's on Zoom. I see her face.
Oh, she on Zoom?
Yeah.
Okay. Ms. Hagan,
Here.
Ms. Hano,
Yes, here.
Ms. Harmon.
Here.
Ms. Nguyen.
Here.
Mr. Piontek.
Yes.
Ms. Richard is not here, but we have Ms. East in her place. Mr. Rafa. Here. Ms. Stewart. And Ms. Womack.
Present.
Okay, we do have a quorum.
And might I say, I'm happy to take, I'm sorry. Oh, you want to keep
Go
going?
ahead.
I'm happy to take questions, but I would invite Natalie from the OAS perspective and Brian, who's on the line from the Medicaid. This impacts all of us equally. So if there's questions you guys have, Brian, Natalie, please feel free to jump in from you guys' perspectives as well.
All right. Thank you, Julie, for those updates. Anybody else have any questions for Julie before we move on? All right, next on the agenda. Yes, sir.
My concern is, you said, at first you said y'all not in compliance with, state things. Can you say, when they say y'all not in compliance, how long they giving y'all to be in line with some of this?
Yeah, so that last page shows you, there's some things that we have to do within a year and then some things that go all the way up to 8 years. So they've kind of extended it, saying different things have to be in compliance in different years.
Okay.
So we have time to work through them.
And what major things they giving you to be in line with? What is the major things that y'all have to work on?
All of them.
All of them is your top thing.
Yeah, we have to work on, I think, what you may be talking about, Eric, I think some of them we will have more work to do than others. So one of the things that's kind of nice that they're doing at the national level, whether it's with the different conferences and things like that, is, when you look at all of the states, for some states are already doing these things, like 1 or 2 of them, and doing them well. And all of us kind of have different things. So at all these conferences and things we've been going to, it'll be CMS who kind of gives you more information about the requirement. And then it'll be a state who says, hey, this is how we've done this in our state and this is how it worked. So there might be things you can learn from them so that you're not just kind of starting from scratch. And so that'll be happening over the next few years. And then CMS will be given more guidance out to us in terms of how to come into compliance. My worry is that a year seems like a long time, but when you're actually trying to make any kind of a change in government, a year is nothing. So if you have to get a contract or you have to get people to help you, because we didn't get any more staff in Medicaid or OAS or OCDD, there's all these new things we have to do, but we don't have any more we don't have any more staff to do it. And then if you want a contract to hire somebody to come in and help you do it, which we can do, but they cost money. So we don't know, they're not giving any extra money to be able to come into compliance with any of these things. So we're going to have to take a look. That's why I say we have to really look at what are we doing. And I hate to limit what we can do, but I don't know how we would do much more than this in our, what we've already committed to doing with the Rescue Plan Act over the next few years as we try to look at compliance in these areas.
Okay, and then you said about the dog protection thing, that y'all was looking more at the dog protection thing. That means you looking at some of your cases with dog protection? Are you looking at more with y'all? I may not be saying it the way that you would understand it. Is you looking at the serious cases? Or how y'all looking at that?
So Natalie may want to speak to the APS rule change. That's more around our process and how we do things and what the Adult Protective Services have to do for investigations. On the access rule side, what it means is that we have to take, anytime there's an investigation that's called in, we have to be able to have a mechanism that we're looking at that data and tracking and trending, like, is one person having a lot of incidents, or are we seeing one provider that has a lot more incidents than others? And so we might need to see what's happening in that provider agency, or, so we have to have a way that we can look at that. And then when it comes to APS, what we also have to have is sometimes an investigation gets called into APS. So they start an investigation that's supposed to be reported by somebody in our critical incident system. If it's not reported in our critical incident system, there might be unreported incidents. So we have to have a way that we figure out how do we bump other systems So we make sure that there's not things that are going unreported and then maybe not investigated or not followed on. But Natalie may have more about the APS rules specifically. I don't know a lot about those changes.
Yeah, I don't know a lot about that either. APS doesn't report directly up through me, but I do know that we have been working, Louisiana Adult Protective Services has been working with a consultant over the past year. And I believe that we are pretty much ready to go and in compliance with those rule updates. And we'll be presenting, in fact, at a conference coming up here in Arizona on the work that they have done and the updates they have made to policies and procedures to align to those final rule requirements. So I think they're pretty good. I can probably,
Sorry, just.
you're good. I believe there's a crosswalk that Sharon put together, our director of APS, that I can find and share it with the group. But I'll write that down. But yeah, as far as I know, that work is, if not completely done, 90% of the way there.
My concern is that, if y'all got a case with more places or companies, and that if it's going on regular, how would y'all handle that where somebody's being protected, but you also got people covering up situations that's being done, but it's being covered up on a regular basis, if you understand what I'm saying?
So we have to investigate. So Adult Protective Services just goes in kind of if it's against somebody in the community or a family member. Our health standards section investigates when it's against a provider or a direct support worker. And so because health standards is our licensing and certification, they have the ability to go in and do a look at anybody that's receiving services with that provider. If they find something, they can fine and sanction them. If they don't fix it, they can actually take their license from them so that they can't continue to be providers.
But how can you do that if y'all being noticed that y'all coming out? And that if you being noticed that you coming out and it's being hidden, okay, they can know somebody deep in y'all and then say, okay, you coming out. And boom, and y'all never know the case going on because they being hidden. Let's clean this up real quick before you guys come out and it's being covered.
I don't think they give notice when they come. I think if they get a call, they usually go out without, they don't call the provider and say, hey, we're coming. They just show up.
So it's being they being protected without y'all knowing.
That probably could happen. I don't know. Like, unless unfortunately, because I don't know how you find that. But I think what they really want to be able to do is use so when you're looking at aggregate data like that and you see, are there more people going to the hospital or is there a pattern? It at least draws your attention to the fact that we need to go pay more attention to what's happening over here.
Okay, I'm not trying to hold you guys up. I got some questions. That 80% that y'all speaking on, do that 80% goes to the providers, even though it say if that person want downtown, do that provider still get paid for that downtown? If that person say, okay, I want some free time for about 2 or 3 hours, do they still get paid?
No. So when you get, when a provider, so when you have a worker, that worker can only, so when you have a worker, let's say the worker is supposed to be there from 8 to 4:30.
Correct.
When they get there at 8, they have to clock in electronic visit verification. Right. Let's say at 2 o'clock, you go, you know what, I really want you to go home. I'm good. I'm not feeling well. I want to go take a nap or something. Well, at 2 o'clock, they have to clock out with EVV because they can only clock in and out when they're working with a person. Now they can do it at your home, it's in the community, they can do it anywhere, but they have to be with you. So then when the worker clocks on and off, that's what the provider then bills for those hours. So then that provider can only bill for 8 to 2. So you just lose from 2 to 4:30 because there wasn't any work provided. Is that what you're asking?
Yeah, so if that person says, okay, I want to do it this way, do the provider have more rights than that person?
No, absolutely not.
Oh.
The person has,
Person-centered.
yes. The person has the ability to say that. Now, let me say this. Let me just to make sure, because I'm thinking through. So let's say that the person says, go home, use the same thing I said. They say go home at 2:00. But the worker is worried that if they go home, that person could be in harm or jeopardy in some way. Now, there would need to be some conversation then about that. So they can't just leave and then, because we do have that situation sometimes. I mean, we have people who receive waiver services who use illegal substances sometimes. We've had cases where they've said, go home, and we know that they may be about to go purchase something that they shouldn't, and we have concern about that. They do have an obligation then, even though, yes, it's the right of that person to say, no, I don't want any services, you go home at 2. If they feel like something bad's gonna happen, then there needs to be some conversation around that, because we need to make sure we're protecting
Or your plan.
that person or planning.
Okay,
for
so
them.
I have another question. I got another question with y'all. Why is y'all trying to push for family members to work with clients? Because I don't think that should be, I think that y'all putting certain people in harm by pushing for workers to be with family members.
So I am not pushing for family members to be workers. We have allowed it when the family member wants to do it and the person receiving services wants their family member to do it. But I'm in no way, shape, or form trying to force family members to be the worker.
I feel like that's a danger.
For the family member to
For
be the
family
worker.
members to work with consumers that get this service. I think that's a dangerous loophole. That's not good, because a family member could take over and they think they have more control over that person by working with that person.
That's why person-centered planning is so important. Because it should be that, and we put safeguards in place, that if the person does not want that to happen.
I don't mean to
That it
cut you
shouldn't be
off, but I feel like if that person got more power over that family member and they tell that person, okay, be quiet, because I have this, and they locked into a situation where if I get rid of that person, then what I got.
Then I might not have anybody else.
So I just wanted to ask a question to follow up on that. There are other safeguards, right? Support coordinators are supposed to follow up or
Yes.
do not emergency visits, but like pop-up visits,
Yeah.
more so when the family member is the worker. So that's a safeguard that OCD has put in place to make sure those family members are doing what they're supposed to do. Period.
I understand, but I got one more question and I'm gonna let this meeting go. This is my question. Even though you got that in God, it's a loophole that I want them to look at that's not good in a whole full circle. Because if you're looking for abuse, or if you're looking for anything that's being covered up, if that family member locked, they looking at a check. They looking at controlling everything that needs to be controlled. And I want them to look at it to say, okay, we need to look at this situation.
No, I agree. And we're trying right now, same thing. So this isn't required of us, but we are trying. So in our EV visas, I just mentioned the electronic visit verification when they clock in and clock out. So every single direct support worker is in that system. So we are trying to, and I think it's just now finished, figure out how we identify when one of those workers is a family member living in the same home, so that we can be doing some additional like data checks around making additional things that we can be doing to help make sure that person is safe and not in a situation like you're talking about. Unfortunately, I do know those exist. I see them. So I do know those exist. And we do think about how can we mitigate those, but at the same time, how can we mitigate that without just saying, no, it can't happen? Because there are also times when it's working and it's working very well. So, it's hard, you don't want to go in all one way or the other. I think that's why those safeguards and having not just reportable things, but data and other ways we can check things that help us know if it's going well. So.
And it's more because I'm just curious.
Okay.
For the incident management systems and their reporting requirements, like this, the electronic systems, are they for consumers or more for administrative?
Administrative.
Administrative, okay.
Mr. Piontek has his hand raised.
Okay.
If you had some questions earlier.
I totally see and know who you are, but I also know the difference between professional and parents. But there is a difference when you have professional people. There's a half and half with that. And I've had numerous of occasions assisting people like that in my own high school. And it can go either way. It's not just always professionals. It's not always just parents. It's half and half. You got to have a fairness of both sides in some way, shape, or form. And for my example, I had homeroom in my own high school. It was chaotic, but once that teacher left, she put me in charge. There was no doubt. They just knew who I was. And I said, sure, that's not a problem. You can step out. So, I mean, it's how you look at it for the whole picture.
Okay.
Thank you, Tony.
You're welcome.
Okay. Any more questions? Okay, let's move on with our agenda. Next on the agenda is.
Sorry.
If I recognize,
Yes, Jill.
sorry. So Julie, what is this total compliance timeline?
I think it goes all the way up to 8 years.
Yeah. Okay, cool. Thank you.
Most of it is 6 years. The quality measures go all the way to 8 years.
Okay, but by this year, you think this will be in compliance?
Do I think what'll be in compliance?
This thing.
All of it?
Well, and I'm just gonna rate 6 years. All right, cool.
Yeah, I mean, I don't have a crystal ball. I think what I can tell you that states are really pushing for, and I think we were talking about this in the break. What a lot of us are pushing for is because the rule came out much quicker than rules typically come out. And because there's not sub-regulatory guidance yet in most areas, and I appreciate that they want to hear from stakeholders and states and you guys and providers before they come out with the sub-regulatory guidance. But because there's so much unknown, what I think a lot of people are pushing for is, could you say, for example, pick person-centered planning, that's due in 3 years. Well, can it be due 3 years from when you get out the sub-regulatory guidance? So we know specifically what we're supposed to do instead of 3 years from July 1, 2024, which is what it is right now. We've asked if there will be considerations for extensions. What CMS has just continued to say is that we'll consider that when we get there. So, you know, and Brian might fuss at me because I probably shouldn't say this, but if you want Julie's Julie's honest opinion is no, I do not think we'll be able to come into compliance with all this in the time frame that they had. But if we have to, I guess we'll have to figure that out. And we're gonna need a whole lot more resources to be able to do that. And there's just not a lot of other resources, a lot of those resources available. So Brian, you can fuss at me if you want to, and you guys may feel differently, but it will be very, very difficult for that to happen.
If I could, just to add to Julie's point, I think when she was mentioning the sub-regulatory guidance, I think that that's very important because the rule kind of vaguely states what we have to do, but it's that detailed guidance that we get from CMS, which is so important because we don't want to start down the path of developing our policies or building these new systems to comply with everything and then get further guidance, which will cause us to have to change everything. So I do actually agree with you, Julie, that it's going to be tough to meet those timelines as they're currently laid out, especially since CMS published all these rules without the detailed guidance ready to go when the rule was published, because we likely won't get a lot of that for about another year or so. So
some of it not till 2026 is what they're saying.
Yeah. Yeah.
Oh, that's interesting. How so? When someone said 2026.
That's when CMS is saying some of the sub-regulatory guidance won't come until 2026.
Okay.
Lauren, you have a question?
I guess this is for all of the, collectively. When we were going through the bylaws, we were saying like that we could recommend subcommittees for any of these objectives. Is that something that the council could request a subcommittee to help you with any of these objectives to start getting, even if we don't have guidelines, just you could send the group something or stakeholder questions or something to get y'all started? Would that be helpful?
I think that we may, I do think it would. I think.
Or is that something we should put on the agenda for maybe next?
I was going to say maybe October, because we'll know more after we go to the conference. And then what it may be is whether you guys decide to do subcommittees or whether we decided to use, like have a 30, 45 minutes as a standing agenda item in this committee meeting spent to certain topics. And we could identify the topics and let people know what they are ahead of time so they could be thinking about ideas, and we could use it like as a brainstorming, maybe pick like the interested parties advisory group. Maybe we could have an agenda item one day, like what do we think that needs to look like? Who might that be? How do we reach out to those people? And you guys can give us recommendations since you have OAS, Medicaid and OCD all here.
Since we're here anyway.
Again, just a suggestion, maybe instead of trying to, I know sometimes it's hard for people to find more time.
That's what I was saying.
So instead of some of the other reports, it may be.
Even if we could go sit in a different room, if we're doing lunch.
Yeah, defer to you guys on how best to do
I don't know
that.
how that works, but I was just saying,
Yeah.
maybe a subcommittee to help, because this seems like a big undertaking, but I know this affects a lot of people with OCD.
All right, I'm gonna ask that we move on to the next item on the agenda. We're getting behind on our schedule. So next on the agenda is an update on Families Helping Families in New Orleans. Members, we've been discussing Families Helping Families in New Orleans since this summer. This center is currently on probation due to concerns about center management and functioning, which were brought to light in their fiscal year 22 legislative audit. At our last meeting, due to ongoing concerns in the FY 23 audit, you recommended to the council and they approved to restore partial funding to the center this fiscal year. In your packet, you have an updated quarterly report, which the center has provided as part of its probationary status. Now I'd like to turn things over to the center's executive director, Aisha Johnson, who will share with us the things the center has been working on to address council and member or the public's concerns and what the center will be working on in the coming year. Ms. Johnson, you have the floor.
Hi. So, we've been actually just closing out, and closing out of all of our books and everything from the previous, fiscal year. I started engaging, with our, auditors. We've also completed the center, financial, review, which we were shown to have a $10,000 deficit that we ended with. So ended with $10,000 in the red, which wasn't bad, that even though we had some, we had those additional cuts, and even though we cut, certain places, but we did have an increase, of like 2% of of additional funding that we were able to obtain. We continue our community outreach partnerships. This fiscal year, we are just preparing to continue to work with our partners on on more outreach in Plaquemines Parish, more outreach in St. Bernard parishes, and increasing our outreach in Orleans Parish our population continues to grow. We have our advocates are in the MHSD centers on Monday and Wednesday to meet with families. So what I'm trying to implement now is more involvement in the community instead of having our advocates and stuff just sitting behind the desk and waiting for our calls to come in. So we want to be on certain days. We're going to be out in the community and meeting our people where they are, especially in Plaquemines Parish because of transportation, etc. Yeah, we're moving forward. We are we're excited about what's to come this new fiscal year. We do have some concerns with our State Department of Ed contract. So we're waiting to hear what's going to happen with that finally, I guess by August, to see what's going to happen with that. That may impact our budget that we have, that the board has adopted this year. So yeah, that's basically where we are. I'm not sure if I missed anything. With you guys have any questions for me?
Any questions?
I have a question. So, hey, Aisha, it's Brendan. I don't know that you can see me, but hopefully you can hear me. So you had mentioned you ended the year with a $10K deficit. I had heard, and I do not know if this is accurate, that there might be a handful of layoffs at your center. So I'm wondering, is that tied to the deficit or is that tied to reduced funding next year, if it is accurate? And what?
Say that again. I'm sorry. There was a handful of what?
I had heard that there was going to be a handful of staff at the center that would be laid off, or furloughed, or whatever language you want to use. I don't know if that's accurate. So I just wanted to. Okay, so you don't foresee any layoffs of staff at your center?
Well, the only layoff that we have is that our assistant director will be leaving, and with our education staff, there will be some hours cut due to the whatever the SDE cuts will be, but there's no layoff. No one is. Yeah.
Okay. And as far as the 10K deficit this year, what, I know y'all have adopted a budget. Next year, is there an anticipated deficit, and what's being put in place to keep out of the red in FY25, knowing that some of that funding may not be there, may not be able to be recognized?
Yeah, so we've started, and I don't know if you all know, but I have a development person. And we have started our efforts with our annual fundraiser, which usually brings in a pretty good amount of funding based on the honorees. We'll know how many, how big that pot would be, but we've projected, last year we raised about 56,000. We're projecting about 80 to 85,000. I have also been in talks with folks at Congressman Carter's office to speak possibly about funding or helping us with funding as well. I have a meeting with them tomorrow. And also just a bunch of grant writing and fundraisers and working, with the community to get additional funding.
Thank you.
Oh, and we also have some pledges, like folks that have pledged and said that they would donate in this fiscal year and the amounts that they would donate. So we have that back up as well.
So does the center at all, I know some centers do this, I don't know if you're the one where essentially you've created budget scenarios, one with if all your funding comes to fruition, one if it's only partial.
So
Do
yeah,
you
so
have
if our
that?
budget, yep, and if our budget doesn't come to fruition, we would have a $30,000, I think it was like a $30,000 deficit.
And so y'all have plans in place if that 30,000 is seen on the horizon to be able to offset that, so you're not in the negative?
Yes, we do.
Okay.
Yeah, and the board, we have a new board treasurer and of course a new board president. And so there's been a lot of things, a lot of talks around all these things that we're putting in place. So yeah, I think it's, yeah.
Okay.
Do we have any more questions? Stephanie?
I'm sorry, I just have a quick question. Under the major fundraising campaigns, I see that the gala raised 56,000. Is that the profit or is that the total amount that was raised?
That's the total amount that was raised.
So my question is, how much was actually raised? Because how much did it cost to put on the so is it?
So it cost about 10,000, maybe 15 to put the gala on. We keep our costs very low. We have a space that's donated and other things. So yeah.
Okay.
Any other questions? No other questions, so we'll move on. Next, we're going to move on to our contractual activities, and we're running a little low on time, so I'm going to ask y'all to keep it brief and refer folks to the
and real quick, we met all of our deliverables for last fiscal year. Just said that.
Thank you. So, Hannah, will you start us off with the Partners in Policymaking?
Yes, sir. Partners in Policymaking last quarter, we wrapped up the year. We had 18 that graduated of the 20 that started. So it's a good bounce back from last year. I'm trying to keep it quick. It was awesome. This is Rebecca's second year as a coordinator. She's been doing great. And another little pro is we had multiple of the PIP graduates. By PIP, I mean Partners in Policymaking graduates that applied for council membership. So that's always exciting to see the graduates apply, and fingers crossed.
Right.
Any questions on partners? Cool. Next up is the Youth Leadership Forum. That also just happened this last quarter. It was held in June at the University of Louisiana in Lafayette. We had 10 delegates in attendance. It was also a great event, lots of speakers and panelists. Our former chair, Rashad Bristow, came and spoke, entertained everybody, as Rashad does.
That he did his push-up.
Oh, yeah, they had him do a push-up. They had him tying a shoe. They were really wanting to test all the knowledge he had and skills. And he happily obliged. He was like sweating and but he kept them entertained and went well beyond his schedule. But so it was awesome. Next year, we're going to be moving it. They're going to move it back to July. They found that it was just a better schedule to have it in July versus June. They're also looking at possibly changing universities. There's been a couple of hiccups. And I believe it's not that ULL is not an option, but that they're just going to widen the search a little bit. And one other thing, they have the ACA accreditation is they've requested it. They came to the program a few weeks back to do some different questions and things like that. So fingers crossed, because if they'll find out in October, if it does receive ACA accreditation, then it will be, to my knowledge, the first YLF that's accredited. So that will be great for Louisiana. Shout out. Any questions about YLF?
Our teachers did receive an email for the first time about the program.
Oh, great.
So I did let everyone know that it was received and shared.
Great.
All over Iberia Parish.
That's awesome. I heard they doubled down on all the efforts to get it out there this year. So obviously every year we're believing it's just gonna become a super well known, just like Partners, where it just keeps growing. Any other questions? All right, moving on. Navigating the systems. We just finished a couple of the last training sessions on de-escalation in times of behavioral health crisis. We're in the middle of trainings on person-centered and trauma-informed care. There's 2 more of those sessions that are gonna be happening, one in Alexandria, one somewhere in central Louisiana. So we'll be finding out about the dates on those and sharing that information. And then lastly, training-wise, they'll have a virtual training on how to pick a provider. That's also being scheduled, so we'll push that out as soon as we have information on it.
All right.
Who's doing the trainings on the trauma-informed care?
That is going to be, yes, Hutzel and Grow, the contractor.
Okay.
So they might be collaborating, we're trying to collaborate with other.
Any more questions for Hannah before we move on?
And I had one other thing, sorry.
Okay.
Sorry, Mr. Charles.
Yes.
It's not on the agenda, but I wanted to shout out to Mr. Tony Piontek. We're doing a disability pride campaign called Share Your Story. And Mr. Tony Piontek shared his story, and he was on our Facebook today. Shining bright, with a big smile. So I just wanted to share that because it's not too late if anyone wanted to share their story. You can find it on our Facebook. If you want to share a story about your child, that's great too. We also had some parents whose children are older, ask the questions to their children or video their children. So it's up to you guys, but it'd be great to see a few more council member faces.
And if you see my hand, can I add, I know all of you, I just connected with Christy before this started, but look up the website, ndsccenter.org. Right now, the whole world is actually there at the whole event. Oh gosh, I can't think. brain fart, although the Down Syndrome Congress website, the Down Syndrome Congress our Down Syndrome Congress event that's in Phoenix. I don't know if y'all knew that.
Thank you, Tony.
Anytime.
All right, thank you, Hannah. Now, Rakisha, will you give us an update on the Families Helping Families
Yes.
and the voting initiative?
Yes. All right, so a little update on LaCan. As of June 2024, LaCan has over 6,800 individuals registered for the council and the LaCan listserv to receive information and action alerts. Since October the 1st of 2023, there has been a total of 19 action alerts with 1,667 actions taken. And we've had 8 Yellow Shirt Days with a total of 150 in attendance, with 12 testimonies that were provided. As far as the trainings and meetings, since October the 1st, 2023, a total of 229 LaCan members have participated in 23 virtual and in-person regional LaCan member meetings to discuss various topics, including the agenda and outcomes of the 2024 legislative session, the legislative process, how to become an active member, ways to take action, and also how to connect with your legislators. On the 27th of last month, the LaCan leaders and the FHF directors participated in the legislative session debriefing, meeting to discuss ideas and strategies for improving advocacy activities and its effectiveness for 2025 legislative session. And right now, the LaCan leaders are conducting community input meetings. We also call them member meetings to discuss any concerns and possible ideas for the 2025 legislative advocacy agenda. As far as the legislative visits, during the previous legislative session, our LaCan leaders supported members in a total of 49 formal legislative visits, of which 30 of those visits were with key committee members to discuss the year's advocacy agenda. And that's it. Any questions? All right, so I'm gonna roll on down to Families Helping Families. So since October the 1st of last year, centers have assisted approximately 22,500 individuals with disabilities and families with information, referral, peer-to-peer, and other supports. There have been over 49,000 units of information and referrals completed, with 251 trainings conducted with over 6,000 in attendance. Centers have conducted a total of 462 outreach activities to hospitals, pediatricians, school districts, applied behavior analysis clinics, and physical therapy clinics. The centers are currently in the process of being scheduled for audits. The results of those audits will be provided in the next quarterly meeting. So that's it about FHL so far. And also in your package, you'll have the quarterly performance data. Just a reminder that this form was created right before their deadline to turn in everything. So it's not completely updated, but it will be updated with the final numbers on next quarter for you guys to review.
Yeah, in October, you get a year-end review document that'll list everything, all of the deliverables, what's met, what's achieved, what hasn't been.
Yes. So the last thing, well, any questions on FHL? Okay. So the last thing I have is disability voting rights. The council has collaborated with People First of Louisiana to offer 10 statewide training opportunities. 1 will be web-based and 9 were supposed to be in person to empower and educate individuals on voting rights for people with disabilities. As of October 2023, 1 web-based training occurred with 4 participants in attendance, and 5 in-person trainings have occurred with 60 participants in attendance. The in-person training included representatives from the Secretary of State's office to provide hands-on experience with voting machines used for both early voting and election day voting.
That's it.
Thank you, Rakesha. We have any questions for Rakesha? All right, thank you. Now, Brenton, will you give us an update on the remaining initiatives?
I suppose. Where's my notes? So there's just two more initiatives to talk about. One is our first responder pilot, that's activity 2.2.1. This is our fourth year with the Interaction Advisory Group completing this training opportunity. It's also the final year. I know there was a lot of discussion at the last meeting and at our planning committee meeting of should this initiative continue. I know a lot of people were interested in this particular initiative continuing. But this year has been a very stagnant year. I do think the council made the right decision to move forward past this initiative, at least at this time, because our contractor has really been having difficulty getting first responders to participate in trainings this go round this year. In fact, there was a virtual training event that happened on April 30th, and there were 4 people that attended. They were from Plaquemines Parish Sheriff's Office, Terrebonne Parish Sheriff's Office, and the District Attorney's Office. And that's been it. That's all that they have been able to arrange as far as trainings go. There was an agency-wide training scheduled for Plaquemines Parish Fire Department. And I believe there was a medical issue of some sort for the training coordinator there, and he wanted to postpone the training because he wanted to make sure he was available whenever that training occurred. So I'm hoping whatever that issue is resolved before the end of the initiative, and we can get back out to Plaquemines Parish for that training. And I believe they're currently working with the Marrero Fire Department and different surrounding agencies there to try and get a training session scheduled a little bit later this summer. They were also supposed to go to, I think it was the Autism Society of Acadiana had some sort of conference or meeting or something that they were doing at the end of June. And our contractor was going to be there to host a training at that time because there was supposed to be some first responders that would attend. Since that happened at the end of June, I have not received that information yet as far as how that training went, if it was able to happen. One of the things I did ask the trainer to do, I guess it was earlier last month, was maybe pivot away from first responders since we're not getting a whole lot of traction there, and maybe try to cater trainings, virtual training opportunities to our self-advocates, family members, caretakers. I know in previous years he has done trainings of that sort, and he has kind of started up his own master class type sort of trainings. And so if he's able to offer those, we encourage him to do that just to try to get some information and some trainings out there for folks. And of course, he is also looking at if he can get some virtual training scheduled for first responders if they would attend that, but it just really hasn't been successful. One of the things that Dustin, who is the contractor, would do when he comes down here to do a training, he then goes to other fire departments, police stations, areas down here, and kind of has that face-to-face sort of conversation about the training, which I think in previous years has helped get these trainings scheduled. But without getting anything on the books on the early end of things, he hasn't been able to be here with some of those agencies. I mean, there have been hundreds, I would say at least over 500 first responders throughout the past 4 years that have been trained. So I do think this initiative was successful, and that might speak to why maybe we're having a little bit lower turnout or interest now, because we have exhausted a lot of those agencies that are willing to participate. We also do run into occasionally agencies that they have their own sort of disability related training that they participate in, so they don't feel the need to participate in the initiative we have. So that's it for the first responder initiative. I don't know if there's any questions about that one. Great. Next is our emergency preparedness and response training. That is Also in its fourth and final year, so there are 2 trainings left in September. So those are the 2 trainings that you can attend if you want to participate in this initiative. If you haven't been to it already, that's your last 2 opportunities. We did have a training session in Alexandria that was April 29th through 30th. There was one in Baton Rouge in early May 1st through 2nd. I did go to the Baton Rouge training, and we had a good turnout there. There were about 13 in Baton Rouge, not quite as many that had registered, but we usually always have a few that don't show up. And then in Alexandria, we had 21 individuals attend that training. And normally anywhere between 20 and 30 has been a good range of how many people attend these trainings. I want to say generally around 35, 40, they no longer take registrations or you're on a wait list. So decent turnout for those trainings. We have Shreveport is coming up. Let's see, when is that? Sorry, it's going to be Lafayette for September 9th through 10th. And then Shreveport is currently scheduled for September 11th through 12th. I will say, I've already sent out an LADDC news advertising these trainings. I'll be sending another one out at some point this week. If you are interested in attending the one in Shreveport, you need to hurry up and register so our registration numbers can reflect the expense for me to bring in Niagara to do that training. Right now, there are only 3 people that are registered for that training. And I've told them if that registration does not increase by next week, we're going to go ahead and cancel that training because it's not fiscally responsible for him to come in for 3 people. The Lafayette training has, I think last we checked, it was in the teens. Oh no, it's higher than that. It's over 20 people have registered for the Lafayette training. So I'm pretty confident that one is happening. But Shreveport, again, if you know people in that area, any of the surrounding areas that are involved in emergency management, or they are providers, or they are support coordinators, or people, anyone that is responsible for an individual with a disability during times of emergencies, I think it's important that you let them know and that they can attend this training. Some of you may recall we did have a training in Shreveport scheduled last year that had better attendance numbers. So we did host the training and only, I think, 2 people showed up. So we took a gamble of trying to go back out there because our contact out there assured us that the interest was there and people have asked about it. So we put efforts to bring the training there and it doesn't look like that interest is there anymore. So if you want to go, register. Otherwise, if we can't get those registration numbers up, Lafayette will be the final training. I think I reported out at the last meeting, he did do a virtual training. One of the great things about this particular initiative is it doesn't stop once we have concluded with our grants for them to work on this initiative. They remain in the state. They offer continuing focus groups and advisory groups, and I don't want to say continuing education, it's not quite that, but they do offer these virtual meetings that previous attendees from this training can attend to get updated information or to get updated materials. So they never really truly leave the state. They're not here doing trainings anymore, but if you do attend these trainings, you get access to some of that continuing training opportunities that they do offer. And just a shout out to Volunteers of America, because for the Alexandria and the Baton Rouge trainings, they provided all attendees there with lunch. We don't normally provide lunch for these trainings. You kind of go off on your own, you get an hour lunch break. But Volunteers of America provided lunch for all the members for the past 2 trainings. So we really appreciate that. It speaks to the connections that our trainer has with folks here in Louisiana. Any questions on this particular initiative? All right, that's all I got.
Thank you, Brent. Okay, just some announcements left. Please note after this meeting, the Education and Employment Committee will be meeting in this room. Tomorrow is the full council meeting, which will start at 8:30 in this room. those that registered to participate virtually, you should have those links to the meeting in your email. Does anyone on the committee or have any other announcements to make? Do we have anyone wishing to share public comment?
Got a response to your question. HSS visits are unannounced.
Again,
Those visits are, yeah, unannounced. The health standards visits that you were asking about, those are unannounced. They confirmed that.
There's a.
Okay, we have no public comment, and we will adjourn this meeting.
Does Sherry have a,
No, I think that's the mouse.
oh, the mouse?
Cause I don't see it on my screen. Yeah, okay.
Yes.
Thank you.